That's an exciting sound for an expectant parent, but the stresses of pregnancy and the anticipation of baby's arrival can give first-time moms heart palpitations. One medical center is trying a new approach to guide parents through the process of having a baby. Hello and welcome to 12T Health. I'm Dr. Derrick Desilva. Pregnant women at JFK Family Practice Center are being given the chance to benefit from each other's experiences by meeting together with their doctor throughout the pregnancy. Here's what one of the expectant mothers had to say.
It feels more comforting, basically, having somebody there instead of just saying, oh, so it's not like you only have your family members. You have somebody, not just your doctors, but other moms that are also there who you can talk to.
My next guest is at the helm of this project, Dr. Chae from JFK Family Practice Center. Also with us is Maricris Gonzaga. She recently gave birth to a new baby, and both of you, welcome to the show.
Thank you.
Thank you.
You know, babies make me nervous. You saw me, did you see me sweating before we came on here? You know, but tell me what this is all about, Dr. Chae. I mean, this is different, new, innovative. What's happening here?
Well, basically, centering pregnancy is a different approach to prenatal care, where the women, usually about 10 women who are pregnant, meet with their OB providers throughout 10 sessions during their pregnancy. So in addition to the usual belly checks and the tests that they get throughout the pregnancy, there is about an hour to spend together in a circle talking about issues important in pregnancy, things that will help them achieve a healthier pregnancy, and also gain social support from other women who can really understand because they're going through the same thing.
Right. So, Chris, you went through this,
yeah.
And is this your first baby?
It is.
And what's your daughter's?
Yes.
What's your daughter's name?
Alessandra.
Alessandra. So tell me a little bit about how this benefited you, and why did you opt to do this?
I mean, I really like the centering because, you know, it's like a combination of the medical perspective and the real life experiences of the people. Like the moms, some of the girls in the group there already have kids, so it's like a combination of expectant moms and mothers already, and then Dr. Chae is there, another doctor is with us, so it's really good. It's really a good experience. Like. Very nice.
So beside the, as you said, the regular checks and things like that, what do they typically talk about?
The topics range from everything from nutrition, exercise, what to expect in labor and delivery, taking care of the baby, relationships and communicating with your partner, things that unfortunately most obstetric providers just don't have the time to discuss during a 10-15-minute office visit.
And what do you think, Chris, was the greatest benefit to you during this experience?
The greatest benefit, I think, all the issues and then the concerns, they were able to answer it.
Like what? Give me a for example, an issue that you had that you needed to talk to other people about.
Breastfeeding.
Okay.
Breastfeeding.
That has to be one of the biggest concerns for moms, right, Dr. Chae?
Yes.
So go ahead, breastfeeding. And what was the outcome?
Oh, I was able to breastfeed at least because of that, because I'm really scared of breastfeeding. I don't know if I can manage to do it as a first-time mom, but because of their help, you know, I did it.
Okay, and that has to be, and believe me, I told you I don't go near babies, okay? You can have all the babies in the world, as soon as they grow up and they get to be 18 years old, they can come and see me.
Okay.
But why is there so much anxiety with breastfeeding? Isn't it a natural phenomenon?
It is a natural phenomenon, but unfortunately, I think a lot of moms have heard stories about how much it hurts, how hard it is, and it is a challenge at first to get used to it. But I think what's really valuable, besides the medical perspective, just like Maricris said, is to hear from other moms what they've experienced, the strategies they've tried, and the fact that they're not alone in these fears.
Now, what about outcomes? Have you seen better outcomes with moms and with babies as they've gone through this program with you?
There's definitely national data which have shown less preterm birth rates and such. However, in terms of the breastfeeding, we've actually been studying it just at our center, and women who go through centering at our office are more likely to breastfeed. They're actually 6 times more likely to breastfeed than women who just go through the standard office setting.
Now, how old is your little one?
She's almost 2 months.
2 months.
Next Tuesday, yeah.
Oh my! I'm getting ready to fall off my chair here. And you're still breastfeeding?
No, now it's combination. Yeah.
You're going back and forth. And at what point do moms switch over, or is that personal choice?
It's a personal choice. It's a personal choice.
It's hard.
Yeah, I'm sure it is. I'm sure that there are challenges when it comes to that. But when we talk about this whole program, how do people sign up? How do they join? What do they need to do?
Basically, what happens is that when women enter our practice, they go through a Health Start intake where a nurse coordinator goes through their history and offers the program to them. And so the women who choose to enter prenatal care in this way are fit into a group. There's a new group every month for women who are due around the same time. And so there's a lot of opportunities for them to join if they'd like.
And has this experience given you a more normal perspective, normalized perspective as to what's going on with your baby?
I think so. So far, yes. I could say yes.
Now, you're still going through this, right?
Yes,
Are you
yeah.
still, and how long will you typically continue?
There are 10
after birth?
sessions, and then we have a reunion session so that all the moms come with their babies. We see how they're doing. If there are any other issues, we can help them with. It's one of my favorite times because you finally see the outcome.
Very much excited.
That must be. And have you been to a reunion?
That's going to be next week. I'm very much excited to see my friends.
And how many moms gave birth at the same time as you did?
I don't know. I think I'm the only one that day.
Yeah.
That day.
But
we
within
have
the month,
different
probably a
dates,
couple of you.
There were 7 women in Mara Chris's group, although they range in size from anywhere between 7 to 14 in terms of the group setting.
Wow. Do you think this is going to become the norm with regard to pregnancies? Or are you hoping it would go that way?
I'm certainly hoping it will become the norm. Centering pregnancy was actually started by a nurse midwife, Sharon Schindler Rising. But I'm really hoping that more and more OB providers, whether they're nurse midwives or physicians, will adopt this model because it really is a wonderful way to provide education and support for mothers.
Right.
And also, personally, I find it much more rewarding.
Now, are dads allowed to show up?
Yes.
Or is this just for moms?
Yes.
How about grandparents? Can they show up too?
I think so.
Well, because I'm showing up. I got news for
My
you.
sister came twice.
Yeah, but I'm talking about grandparents.
We've had grandparents come, we've had friends come, and sometimes the friends have liked it so much that when they became pregnant, they joined centering.
That is awesome. Hey, thank you so much for being here with us. Good baby.
Thank you.
Good baby. We were worried about that, but thank you once again for joining us, guys.
Thank you
Keep up the
very
great
much.
work. Stay with us on 12 to Health. I'll answer your email questions when we get back.